So we're live. And it's great to see you. Seems to be an annual event, but we're live talking about Medicare and NETS. I'm here with Ann Karish from the National Council on Aging, and we're going to discuss Medicare and what's changed and what's gone on since the last year that I've seen you. It's great to see you again. How are things going back in the East Coast?
Oh, great to be here, Josh. It's like being with old friends after all this time. No complaints on my end. I hope everyone had a happy Thanksgiving and all, and we'll happy to jump right in and talk about, just the highlights of Medicare in terms of Medicare basics, questions that people always seem to have because Medicare is confusing, and we'll look at some of the changes coming down the pike as well.
So I'm going to disappear from the screen for right now, and I'm going to share your screen, and there you go. You're ready to go.
I'm ready to go. Well, again, I wanted to thank the NETS community for having me. It's always a great opportunity to get to talk about Medicare because indeed it can be very confusing. So with that, I'm going to go ahead and there we go. Get started. I am Ann Karish, and I'm with the National Council on Aging, and I am delighted to be with you. And in my role at the National Council on Aging, I am the Senior Program Manager for Medicare, and I work a lot with the folks that people really do rely on, the state health insurance assistance programs. We do a lot of training with those folks, so it's great to talk to you and share information about Medicare for 2022. Giving you a little bit of a rundown, what we'll talk about today. We're going to go through some basics of Medicare. You find that often people don't know some foundational things, and it's always good to do a quick review on that. We'll talk again about some enrollment basics. Again, things people often make assumptions about when they can enroll and when they cannot. Sometimes good to go through that. Also talk about Medicare annual open enrollment. That is happening right now. And just what you would need to do to compare plans for 2022. And lastly, talk about some changes coming on the horizon. So let's just jump right in. I don't think for this group or any group, most of you have an idea as to what is Medicare. It is a federal program that provides health insurance. For the most part, to be eligible for Medicare, you need to be 65. That is normally what it is. However, there are some groups who are indeed eligible for Medicare prior to 65. And for those to be eligible, it would mean that you would need to be determined to be disabled. And that would be a designation that would have happened via Social Security. And after 24 months of being designated disabled, then you would be eligible for Medicare under the age of 65. And then additionally, there are a few diagnoses that would make you eligible for Medicare early. And one of those is ALS, which is the amyotrophic lateral sclerosis. And a second one is end-stage renal disease. I know that that's ESRD. I know that was a question that came in from the NETS community about end-stage renal disease, if that diagnosis does make you eligible under 65, and that is indeed the case. All right. Okay. Oh, wait a minute. Now I just kind of, what did I just, okay, I don't know what's going on there.
No worries, Ann.
I don't know what, I'm in some kind of mode here that it keeps repeating.
No worries, you're on the beginning Medicare slide.
I'm on the beginning Medicare, but there's something in my visual Medicare options.
Yep.
There's something in my, okay, there it goes. There was something in my feed. Okay, great. Oh, no, I'm in the Medicare slide. So I want to be back here as to, can you see beginning Medicare? Is that what's up the screen? Great.
Yeah.
Okay. All right. So one of the questions that often comes up from my end is, when does Medicare begin, or how do I know if I'm eligible for Medicare? And I think that people are always expecting some kind of packet that Medicare was going to send them. But unfortunately, that's not often the case. The only time really Medicare really it's Social Security contacts you, is if you are eligible for if you are eligible for SSDI prior to prior to being 65. If that's the case, then guess what? Medicare is going to send you a packet. It's going to have your card in it, and it'll tell you how to enroll. Aside from that, you're not going to get any type of notification from Medicare. So if you are not receiving SSDI, then you'll want to enroll into Medicare at 65. And what you'll want to do is you'll have to contact Social Security directly, and you have to enroll in Medicare. And if you want to, and if you're not receiving Social Security benefits of any sort, and you are in a health plan that is based by your employer, then you can delay enrolling into Medicare, and you can delay until you lose that employer-sponsored health insurance. Okay. And that employer-sponsored health insurance means you have to be actively working. And it could be you, or it could be your partner or your spouse. If they're working, then you can continue to stay on that health insurance and delay it. And then you'll get a special enrollment period. Okay. So let's move on to the next slide. Oh, geez. I keep hitting the wrong one. I keep hitting the wrong button. There we go. All right. So I want to make sure I'm on the right slide. Yes, there we go. Fantastic. So before we talk about any more about enrollment options, I want to make sure everyone's on the same page with what are the different pieces of Medicare. Medicare A, Medicare B, Medicare C, and D. So first of all, to review that, Medicare Part A is your hospitalization insurance, okay? And it's also going to cover hospice as well. Medicare Part B is for your doctor services, and that will be for your doctor's appointments, any labs or x-rays, things like that. That's all covered under Medicare Part B. Medicare Part D is a prescription drug benefit, and those are your largely your parts of Medicare. That's what it is. Whether you're going around these, if you look at this slide, you can see it's kind of two columns. Original Medicare is going to be on the left-hand side, and you're going to have your Medicare Advantage on the right side. And Medicare Advantage is often called Medicare Part C. So when you are enrolling in Medicare for the first time, you really need to decide whether or not you want to go down the left or right column. Okay. So what Medicare Advantage is, it really bundles Medicare A and B and often Medicare Part D, which is the drugs, into a single insurer, a single provider. You may know these as HMOs or PPOs. And the thing being is that all the benefits that are covered are the same. Maybe you'll get a few more advantages benefits if you go down the Medicare Advantage route. So just let's go through this just one more time. You're going to get when you enroll in Medicare, you're going to need to make a choice. Do I want to stay in original Medicare? If I have an original Medicare, I'm going to need to enroll in obviously in Medicare Part A. I'm going to need to make a payment for a Medicare Part B premium, and I'm going to need to select a Medicare Part D plan and pay a premium for that. I will also need to select a Medicare supplement plan, which is going to cover the things, the copays that original Medicare does not. Conversely, under Medicare Advantage, you get Part A. You also have to pay your Medicare Part B premium. You do also have to typically pay a premium for your Medicare Advantage plan. Medicare Advantage often covers Medicare Part D, includes a prescription drug plan, and it again may offer other benefits, but you do not need a Medigap plan on that. So that kind of gives you just an overview of that, and some of the considerations if you're looking at whether or not to go with original Medicare or Medicare Advantage. Sometimes it's important to know that really under original Medicare, any doctor that accepts Medicare, you're going to be able to see under original Medicare. Whereas typically under a Medicare Advantage plan, a HMO, or even some PPOs, you're going to have a network limitation. You're going to have to use the doctors and the providers and the hospitals within that network. So that's one of the biggest drawbacks of the Medicare Advantage. Conversely, though, with Medicare Advantage, there are certainly copays and out-of-pocket costs, but there's a limit on those out-of-pocket costs. So that's often very attractive to people. Whereas with Medicare, original Medicare, there's not a cap on the out-of-pocket costs that you could potentially have. And you're going to have to purchase a Medigap plan, and you're going to have to purchase a Medicare Part D plan. And that's something that's often incorporated into Medicare Advantage. There's the copays, and it's a single type of payment mechanism. And they may also have supplemental benefits, which you often hear about this. That could be whether it's a part of a dental package, or maybe you find that there's some transportation or home delivered meals. Typically, those are available with Medicare Advantage. And I don't know if you all have seen the commercials with like the Joe Namath on there telling you can get all of this stuff, for next to nothing. But I would just say be wary, because those supplemental benefits, while they do certainly exist, there are limits on those supplemental benefits. And for some folks, if you live in a state that doesn't have the Medigap, enrolling in a Medicare Advantage plan often limits your ability to get a Medigap policy down the road if you ever want to come out of that Medicare Advantage plan. And we'll talk about that more in a little bit. Okay. All right. So what I always like to say to people is, they always say, well, when do I enroll in Medicare? And my answer always is, for most people, you're going to need to enroll into Medicare when you are first eligible. All right. And that is during your Medicare initial enrollment period. And we will go through all the Medicare enrollment periods in an upcoming slide. But the whole point of all of this is, what I'm trying to say is, normally for most people, they need to enroll in Medicare when they turn 65, unless they are currently working. They are currently working, or their partner or spouse is currently working, and they have coverage through that employer. All right. So keep in mind that COBRA is not considered an employer plan. It's not through active employment. It's something you pick up when you finish that employment, when you're no longer working at an employer. So that's not considered a eligible, that does not allow you to deter or defer your Medicare enrollment period. And it's also important to keep in mind, in order to be able to enroll, or be able to not to be penalized for not enrolling in Medicare and be eligible for a special enrollment period, you must stay covered. Like that, if you're carrying that employer group health plan, you must keep that employer group health plan until you enroll into Medicare. You cannot have a lapse in coverage. All right. This is a really important point, the next one. It is about people who are enrolled in the Marketplace plan. If you have a state that has a Marketplace plan, or you're enrolled in the federal Marketplace plan, you need to enroll into Medicare when you are first eligible. Because that's one of the provisions they have when you turn 65, or when you no longer are. If you have a Medicare Marketplace plan, you need to come out of it. You're going to lose all your subsidies, and it's going to make it less affordable. So you need to move out of that plan and go into Medicare. And keep in mind, if you don't enroll when you're first eligible, you're going to have late enrollment penalties for Medicare Part B, as well as for Medicare Part D, which is for the drugs too. All right. All right. So as I promised, we're going to go through Medicare enrollment periods. And it's important to know that you can't enroll in Medicare just whenever you want. That's kind of a misnomer that folks have. So it's always important to know that there are certain times that you can enroll in Medicare without penalties. Certain times you can enroll in Medicare later on, but it's not open to everyone all the time. So the first opportunity you have to enroll into Medicare is during your initial enrollment period. And this is when you typically, for most people, it's when you turn 65. So what it means is 3 months before you turn 65, the month of your birth month, and then 3 months after you turn 65, that is your initial enrollment period. And that is the best time to enroll into Medicare, unless you are working and getting insurance through that employer plan. There are also special enrollment periods, and that special enrollment period and having employer insurance is one of those. It's kind of special circumstances that allow you to enroll on an exceptional basis. And again, there are a lot of limitations on those, so you need to think carefully. But having your employer coverage end is one of those special enrollment periods. All right. We also have a general enrollment period, and this is from January 1 of each year to March 31st of each year. And a general enrollment period is really for anyone who failed to enroll in their initial enrollment period. So what it is there's an opportunity every year for you to enroll into Medicare Part B, and you apply during January 1 to March 31st, but your coverage is not effective until July 1st of that year. So if you're finding out that you're ill and you can enroll during January 1 through March 31st, but your coverage is not going to be effective till July of that coming year. So you can see how that could be a problem. We also have an open enrollment period. And again, that's something that happens every year. And that's happening right now. We are in the middle of open enrollment because it happens between October 15th and December 7th each year. That annual enrollment period is only for Medicare Part C, which is your Medicare Advantage plans, or for Medicare Part D, that's your Medicare prescription drug plans. As we'll talk about in a little bit, the plans change every year. So it really is worthwhile for folks to look at the new plans and to determine whether or not that plan is good for you in the future. So know that that is something you'll need to look at every year. And again, you'll find that Medicare Advantage plans you can enroll and make a change during October 15th to December 7th, or the Medicare prescription drug plans, you can make a change. And again, that change will be in effect for January 1. All right. What I also wanted to mention, maybe people don't know about this, is the Medicare Advantage open enrollment period. And again, this is just for Part C. If you find yourself in a Medicare Advantage plan, or you enrolled in a Medicare Advantage plan, and maybe you enrolled and you found that this is not what you wanted, it's January 15th and you realize you don't want that, you can make a change into another Medicare Advantage plan. So that means from January 1 through March 31st, you can move from one Medicare Advantage plan to another Medicare Advantage plan, or you can move from a Medicare Advantage plan to original Medicare and pick a Part D plan. All right. So that's something that happens every year. That's annually. It happens every year. But what you'll notice, and this is what we're touching upon in the Medigap open enrollment period, we'll talk about this at length as we move through here. There is not an annual open enrollment period for Medigap, generally speaking. Okay. For the most part, a Medigap open enrollment period happens at 6 months, beginning the month you turn 65 or the month that you're eligible for Medicare Part B. So for the most part, that means you have one of those. And if you pick a Medigap, and you typically keep your Medigap for always. And what, I don't know, a coworker of mine said long ago was your Medicare supplement plan, or your Medigap plan is like that's your spouse, that's your partner. You keep that for life, where your Medicare Part D plan is your date for the evening or something like that. But I think it's important to know, because I'm speaking to a group that's located and based largely in California. I do know that if you live in California and you have a Medigap plan, I know that there is a state law that allows you an opportunity to buy certain plans without a health screening each year, starting on your birthday for 60 days. So know that in California, that is one of the few states, a handful of states, that do have a Medigap annual open enrollment period. So you can change that. That is not the norm in most states. So in a way, consider yourself very lucky that you have an opportunity to switch into a different Medigap plan beyond your initial plan that you picked. That's not necessarily something that's available to everyone, because for the most part, in other states anyway, you would have to go through a health screening, and plans do not have to accept you after that initial enrollment. So I guess I'd be glad I'd been in California if that's the case for you. You don't have to worry about a health screening, and if you need to switch a plan, you can. So, all right. Oh, geez, I do that all the time. All right, let's see. This was a question that came up by several of you in the questions that had been sent to Josh. You were really asking about whether or not you should be moving out of your Medicare Supplement Plan F to a Medicare Supplement Plan G. So just to give you a little background on this, what was happening, Plan F, as those of you who are enrolled in it know, it is a very comprehensive plan. And one of the benefits that it offers is it covers your Medicare Part B premium. And back in, let's say, I guess a few years ago, it was determined that Congress determined they didn't want to have first dollar coverage offered in Medicaid supplement plans. They wanted to stop offering first dollar coverage. So therefore, they determined that they were no longer going to make available Medicare Supplement Plan F or Medicare Supplement Plan Cs, because both of those plans had first dollar coverage for the Medicare Part B deductible. So what they determined was that they were no longer going to make them available to folks that are new to Medicare. Now, if you were in a Medicare F plan or a Medicare C plan, you could certainly keep it. And if you were eligible for Medicare back in up to 2020, then you could also keep those plans. They weren't going to kick you out. And if you were eligible, you could, and because you were eligible for Medicare back in 2020, even if you didn't enroll, you could still keep those. So it was kind of a grandfather in. So just in response to the many questions that came on through this, I don't have any great answers whether or not you should change plans to the G plan. What I do know is and you all probably know this better than I do, you know that your premiums are going up as they do with Medicare supplement plans. And what's happening if you are in a Plan F, you're not getting any new younger enrollees in those plans. So you may find that the experience could be that more people are using services. So that may be one of the reasons that you wanted to switch, because you thought maybe a G plan would be cheaper ultimately. I guess there's no looking down the road. I don't have a crystal ball, so I can't tell you whether that's going to be your experience or not, but we can certainly talk about it in the QA if you want to discuss it further. Okay. So I want to switch gears a little bit, and because again, these were a number of the questions that came through was, does Medicare cover this or does Medicare cover that? And I thought it would be worthwhile reviewing a little bit, how does Medicare provide, on one basis, does Medicare cover things? And I don't think it's a surprise to anyone that Medicare bases things on medical necessity. Are treatments medically necessary? All right. It's kind of a very broad term, but I think that that's probably the most descriptive thing in determining it, whether, not if something's cosmetic. And I guess there's always arguments about what's medically necessary, but that is what they use as the basis for determining coverage. Also, Medicare does not cover anything that's experimental or investigational. You're really going to need to have FDA approval for services to be covered. And FDA approved for specific diagnoses. And I know that there were things, does Medicare cover for, I think it was proton therapy of some sort? And I would think the answer is going to be, for certain diagnoses, it may, and maybe for other diagnoses, it does not, right? What I thought might be interesting is to make sure that you all know is that if there's a question of whether or not Medicare is going to cover something, you can ask your doctor or ask your provider if they would do an advanced coverage decision to Medicare. They could make a request of the local Medicare intermediary and find out if something is going to be covered in advance of you actually having the service done. And those are known as Medicare Advanced Beneficiary Notices of Non-Coverage. So you can request those. This is available.
Question, Anne, though,
Yeah.
If your center is going to do a procedure, it's really up to them to decide to determine whether there's coverage for it. If they were to say prescribe something and know that your coverage is Medicare, treat you, they can't then say, by the way, Medicare didn't cover this and you owe us $500,000.
Right. Right. Because this is not only can you ask for a Medicare advance, but you can also get something known as an Medicare Advanced Beneficiary Notice period. If your provider is thinks there's a question that something's not going to be covered, then really they have to give you a notification that there's a chance Medicare is not going to cover this. And it can't be a surprise type bill that you had
Right.
no idea that Medicare was going to cover that. Exactly. That's exactly right.
So, and it's usually for the indicated as, we call this on label, but what the label says, but there are things that Medicare will cover off label as well, that either the institution knows that they have coverage for, or will get an advanced beneficiary notice, notice as well done to make sure that they're going to get paid at the end of the day. I know there were some questions about imaging as well. Medicare is, especially for oncology imaging, is required through one of the acts to cover any oncology imaging procedures that are on label. What they pay for or how they pay for it may be a question for the provider, but they're not going to deny a PET CT with an imaging agent as long as it's on label. But continue.
No, thank you. No, this is exactly right, Josh, because it's helpful because you know what the community's facing. So you certainly have input. So feel free to jump in.
No worries.
Right. And I think I go through a little bit of that here in our next slide, just getting a little bit further into this, because this was actually some questions that came through. Someone had asked about end-stage renal disease, and Medicare does cover most services associated with end-stage renal disease. And another individual had asked a question about, was it PRRT, some type of proton therapy? I'm sorry, I don't recall the exact
peptide radioreceptor therapy is medical necessity or FDA approved diagnosis, or on label.
Right. So again, that it always goes back to, is it an FDA approved indication? Is it considered medically necessary for approved diagnosis? And what I think is important to keep in mind, it could be an FDA approved indication for one condition and not something else. So those are things that you and your provider need to navigate and have on discussions about too. And I know it's very disconcerting when you find something is not approved. And that's important to know and have a heads up on that. And really the last piece, again, like you had indicated, things like scans or MRIs, EKGs, X-rays, PET scans are all going to be based on medical necessity, and they need to be ordered by your Medicare medical provider. So that's another piece. You don't get these things willy-nilly, and because you want them, the doctor needs to indicate, or your provider needs to indicate that they are indeed necessary. All right. Okay, well, that was our little caveat about Medicare, medical necessities, and all that. So let's take a little bit closer look at Medicare annual open enrollment, because I think that's really why we are here. Just so you know, this is, again, like I had indicated, Medicare annual open enrollment is for Medicare Part C and Medicare Part D. And again, that's for Medicare Advantage plans and Medicare Part D plans. And just so you kind of have a calendar for yourself, really, it runs through October 15th through December 7th. So if you're going to make a change, you need to make sure you make it that change during this time frame. Coverage is for January 1. And again, and if you're in that Medicare Advantage plan, you can, again, you have another opportunity to make a change. All right. So let's talk a little bit about the Medicare Part D prescription drug benefit. Okay. What is Medicare Part D? It's a federal program, and it's administered through private insurance companies. They really are the face of the Medicare Part prescription drug plan. Okay. And Medicare Part D, it can be offered as a standalone drug plan, or it can be offered as part of a larger Medicare Advantage package. They include the Medicare prescription drug benefit within their Medicare Advantage plan. People are often very confused about the Medicare prescription drug benefit. And it really is understandable, because there are 4 phases of the prescription drug benefit. And often you pay a different amount every time you go to fill a prescription. And we'll just talk briefly about a few of these different phases of the Part D benefit. I think for the most part, people understand about the deductible. This is the dollar. This is the amount you need to pay before your prescription plan or your MA plan pays anything towards your prescription drugs. Right now, we're looking at a $400+ many of the standard plans have like $400+ initial deductibles. So that's going to be you putting out the money until you spend that $400+ dollars. Then you go into the initial coverage phase, and that's where you pay 25% of the cost of the drug. And then we have what was known as the former coverage gap. And this was the donut hole. But over the past few years, the donut hole has closed. So right now, your cost in the donut hole also sits at 25% of the cost of the drug. So previous to this, the cost in the donut hole was higher than the initial coverage phase. And so that now could be confusing, but now you're looking at 25% of the cost of the drugs. Unfortunately, people often think when they hear that the donut hole has been eliminated, they think that they really don't have costs anymore, and that is not the case. The other piece that can be confusing is when you sit there and you look at, I should be paying the same amount through the initial coverage phase as well as through the coverage gap. It doesn't always work that way. That there's the way plans are designed. They often have certain tiered drugs are covered one way in a deductible phase. They're covered another way during the initial coverage phase, and they're covered another way in the coverage gap. So that's that's tricky. Sometimes as you go through the different phases, this is how you end up paying a different dollar amount because it does depend on what phase you're in. Lastly is the catastrophic phase. And this is where you have spent over $7,000. It's actually for 2022, you have spent $7,050 on prescription drug costs. And at that point in time, you are paying at most up to 5% of the cost of the drug for the remainder of the year. So that is when many people actually feel like the drug coverage really kicks in for them, is because that's when their costs go down, is when they enter that catastrophic phase. And remember, this is an annual benefit. This is a 12-month period starting January 1, and you're going through these different phases all during the course of the year. So you can see how this can be confusing if you're not quite sure which part of the benefit you're in. So we can talk about that further if you have questions too. Okay. This was a slide I thought was kind of interesting because I think for your community, this might be helpful. To just talk about what are some drugs and how are they covered? Like, how does Medicare, what are Part B covered drugs and what are Part D covered drugs? And for the most part, if you're going to go to the pharmacy, most of those drugs are going to be Part D covered drugs, your prescription drugs that you pick up at the pharmacy. But there are differences. There are some confusing areas. I know that if you look at the first bullet here under each of them, it says some infusion drugs are covered under Medicare Part B, and some of them are covered under Medicare Part D. I wish I can make it more plain than that, but the case, it'd be an infusion drug, and in some cases it's covered under Medicare Part B, in some cases it's going to be covered under Medicare Part D. So I would say you want to check with your DME supplier. And remember, the infusion drug is typically something that's coming through an infusion pump or something like that, and you're doing that at home. Okay. So
just for those of us who don't have DMEs often, what is a DME?
Oh, sure. Durable. Yeah. Oh, so sorry. You get stuck in this, lingo, don't you? Durable medical equipment. People always typically think it as like wheelchairs, or it could be, pumps themselves. It could be all types of things. Any type of equipment you're going to get that Medicare is going to pay for, you're going to have a supplier that Medicare uses. You just don't go anywhere to pick up this. You want to make sure that you're getting your supplies for a durable medical equipment supplier that Medicare works with. So good clarification. Yeah. DMA, come on, everyone's got to know that. That's part of my lingo. Yeah. Thanks for Josh. So another piece I want to make sure everybody understands. Again, these are nebulizers. So there are inhalation drugs used with nebulizers provided by your infusion or DME supplier again. And those drugs that are like use with inhalers. Like if you're going to get an inhaler, well, that, maybe that can be considered in a form of a nebulizer, but an inhaler is something that's going to be covered over Part D, whereas things given via a nebulizer is something that's going to be covered under Part B. Okay. And this is another one that comes a lot. Drugs administered, like self-administered drugs. This was something that came up in one of the questions. If you're self-administering a drug, typically, and you're picking that up at the pharmacy, so you're purchasing it at the pharmacy and you're administering it, or your provider is administering, but you pick it up at the pharmacy, then that's a Part D as in dog drug. Okay. It's going to be covered under Part D. Now, if you're at the physician's office or you're going to an infusion center and it's something that's going to be administered by your doctor, that's going to be a Part B as in boy drug. Okay. And if you're going for any kind of infusion therapies and you're sitting there and you're waiting for that infusion to be administered to you, that's going to be under Medicare Part B. You're not buying that drug and you're not administering it to yourself. So that's going to be a B as in boy drug. All right.
So I should add some, and one of the questions was on a particular type of potentially self-administrating drug, but that wasn't FDA approved or on label as self-administrating, that you could get at a pharmacy. And so it's really important, and we'll do this in a second, to check your formularies to make sure that that drug is covered. The specific question was on lanreotide, but there's some other long-acting drugs that are taken, as a once-a-month shot that, for whatever historical reasons, are only available through as a Part B and not as a Part D. We discussed this at some strategies for those who are traveling, and while one of the drugs is self-injectable in other countries, it's not on label as self-injectable in this country. You may be able to arrange a Part B visit at an infusion center where you're traveling to. By the way, Anne, just say next slide when you need the next slide, because I realized that the slides were getting cut off and I just threw up my copy of it and it looked a lot better. So just say next slide.
Okay.
And I'll jump to the next slide.
Fair enough. All right, so then let's move on to oral anti-cancer drugs that were covered once available only in an injectable form that were covered by Medicare. Those are a Part B drugs. So if they were oral anti-cancer drugs that once were available only as an injectable, but now they're available orally, those are covered Part B drugs. And let's see, then we have oral anti-nausea drugs, which are given in related to cancer therapy. And so that was something, as long as they're for cancer therapy, then they're going to be covered under Part B, as opposed to oral anti-nausea drugs used for conditions other than cancer. I know that it comes up too. Anti-nausea drugs have come up, I know, from the community as well. And then lastly, we just want to make sure you know that there are vaccines, and vaccines that are covered under Part B are your pneumonia, your hepatitis B, your COVID-19 and COVID-19 vaccines. All the other commercially available vaccines are covered under Medicare Part D, including your shingles shot. And if you have questions about what are Part D versus a Part B drug, there's a link there, and that link will take you to a nice comparison of Part B versus Part D drugs. Next slide. Okay. So now we're moving into looking at your different plans for 2022. So remember, plans change every year. Know that you get an annual notice of change, which is your ANOC, which explains the changes that you're going to get. And if you're enrolled in a prescription drug plan, they'll send you an ANOC explaining the changes for 2022, as well as an explanation of benefits for the next year. So I think that the things that you need to ask yourself is make a list of the drugs that you're taking. Make sure you know the dosages you're taking, the names that you're taking, and how frequently you take them. And with that in mind, then you can start the process. We can go to Plan Finder, which we'll talk about in a minute, but you want to know that. Also, know that, are you open to taking a generic form of the drug? Because you might save some money there. Also, what pharmacies are you using? And are they how nearby? And if you had to change a pharmacy, is that okay by you? And is mail order an option for you? Because these are all things to keep in mind as you're starting to look for a new prescription drug plan. Again, it's Medicare annual open enrollment. This is the time to do things. Okay, thank you. And where do you go? You turn to www.medicare.gov, and this is the Plan Finder slide. And in that little circle in the middle, it says, if you would like to, right, thank you, Josh, put that up. If you want to, this is where you would go to start a search for your new prescription drug plan. If you have an account, a My Medicare account, you can log in and you can save your drug list and save your pharmacy list. If you don't have to, and you don't have to, you can just go in as an unlogged in user and you can do it, without putting any identifiable information in. Next slide, please. So what you're going to do in order to help find a plan is you're going to answer a few quick questions. It's going to ask you what are you looking for? Are you looking for a prescription drug plan? Are you looking for a new Medicare Advantage plan? It's also going to ask you, do you get any type of assistance? There's a series of questions which you want to answer. It'll also ask you to enter all the drugs. And this is where you're going to need to know and make sure you have your list of the dosage, the name, the frequency that you take the drugs, and you're going to put all that information in there. And then a plan results page will come out. And the plan results will be all of the plans that are available in your zip code area. Okay. And what I have circled here is, well, you want it normally goes from top, the highest, the one at the top is the least total cost. That's what comes up first. And what I highly recommend is you make sure you look at the plan detail page and go to the next slide there. Because on the plan detail page, it's not only going to talk to you about your cost, which runs across the top of the page, but I also have circled you. It's very essential for you to look at this circled there in the red, which says view more plan information on Medicare Plan Finder. Go to the next slide there, because that's the only way you're going to know some really, really important details about your prescription drugs. Okay. And this is information as to, tell me what tier they are, which is the top portion, but the lower portion, which I think is also more, the top portion is what tier they are on, but it also talks about what kind of limitations they have. If you can look across, and it's going to talk to you about, it's going to talk to you, is there therapy step? Is it a step therapy? If there was a yes in any of those, that's important to know, because that means before you can take that particular drug, it means you're going to have to take other less expensive drugs before taking that. It'll tell you whether drugs are covered. It'll tell you whether you need prior authorization. This is the type of information you really need in order to make a decision. Okay. It will tell you if the drug is on, are they on the formulary or not? Because if it's not on any formulary, if these are all what says here, it's tier 1, tier 4, tier 5, it would say not covered. And that's an important piece for you to know. All right, next slide there, Josh. So as you can look for prescription drug plans, you can also look for Medicare Advantage plans. And again, it's going to go from high to low. What's going to come at the top of your plan results page is going to be the least expensive drug based on premium and drug cost. And again, you'll want to go into the plan detail page because you'll want to find more out about not only the way they cover prescription drugs, but what does some of these other extra benefits look like? Sadly, go to the next slide. I forget if it's on there. Yeah, here's this. You'll want to go onto this page, which is kind of like going deeper and deeper into the plans. And it'll tell you more about the drug coverage, what kind of extra benefits they have. But I must tell you, whether you're talking about a Medicare Advantage plan or whether you're talking about a prescription drug plan, I highly recommend that, given the kind of drugs that are taken by your, by the folks in NETS, I would really call the plans to make sure they're covering the drugs. Don't just go by what Plan Finder says. I would really call the plans. Narrow your list down, and Medicare Plan Finder says this is the best plan for you. I would then pick up the phone and call the plan themselves and find out how they cover the drugs, because it's too important a decision. It's a great way. Plan Finder, in my way, is a great way to narrow the funnel. But then once you have a couple of the top 1 or 2, I would call the plan and talk to them directly. So, okay, you want to go to the next slide? Okay. So then this is just talking about how to enroll in a plan. You can enroll on Plan Finder. You can call the plan direct. You can call 1-800-Medicare to enroll in a plan. Okay. Next slide, Josh. Okay. Okay. And again, resources for you. You can also call your state health insurance assistance program. I've given you a phone number there, as well as a website. I know they're very busy this time of year. So you want to call and see if they can still be of assistance. If they are unable to help you, you can call 1-800-Medicare, and the representatives on the line can certainly help you. Also, try navigating the Medicare Plan Finder. I mean, it really is a good way to narrow your options. Okay, let's move on to the next slide. So that was our information on Medicare Part D and looking for a new Medicare Part D plan or a Medicare prescription drug plan, Medicare Advantage plan. So at this point, I wanted to just go ahead and talk a little bit about Medicare changes for 2022. Quite honestly, the biggest changes for 2022 are really around telehealth. I don't know if this is something that your community uses a lot or not. What is happening for 2020?
We do.
Yeah,
we
okay.
use it a lot. Given that our specialists are so spread apart, this has been a big boom for the ability to use more telehealth for neuroconsumer patients has been a big boom.
Right. I think that's what I remember from last year. First of all, know that the telehealth services that were covered, that were temporarily allowed coverage in during the public health emergency, are going to remain covered, and some of them are covered until the end of the year of the public health emergency, or some are covered through the end of 2023. So many of that coverage is going to continue for many services that are available via telehealth. Another big change is if you're using any mental or behavioral health services, that is now going to be available post public health emergency to anyone. Prior to that, I'm just meaning telehealth visits. You would be able to see a mental health provider via telehealth no matter where you live in the country. Prior to that, you needed to be living in a rural area. But now after the pandemic or after the public health emergency, that's going to remain in place. Not only can you use them via telehealth, you can use audio only, like using your phone only, and you can have services that way as well. All right. The last change you're mentioning is there's just a two-tier system going to be available to folks, a two-tier specialty formulary system. And this is if you're getting a specialty drug, they're trying to do a way to make specialty drugs less expensive. They can put people on drugs on a preferred tier, or they can put them on the regular tier, preferred tier being less expensive. And there's going to be a flexibility to try to get exceptions between those two tiers. Okay, I'll stop talking now and take questions.
Well, before we let you stop talking, well, I'll let you stop talking of course anytime. I wanted to bring up some specific examples that we were talking about. So I'm now using.
Yeah.
You're now seeing my screen, and where we live here in Northern California. And I've added one particular drug, and you can see, I'm going to have to go back and take a look at my, but you can see that this is actually a drug that isn't covered particularly well, and that you may have to talk to the provider or even the manufacturer about. Because if I'm remembering correctly, what I've done here is taken, and it will show you across all the things that you've selected. This is Zermello, for instance. This is a drug, an anti-diarrhea drug. And so you can see what it will take a look like, what you're paying each month. What I found interesting, and I'll come back here, back to your search results, is you can easily decide to, I'm going to remove this drug, I'm going to add another drug, and something that some of us take are something called rescue shots, but octreotide is a type of shot that we take. And some of us, it will tell you what your formulations are, whether it is the vials that you get, or some of us use this multi-injection. So I'll do the multi-injection pack and say I'm done adding drugs. I found this interesting. Here are the same set of pharmacies, whether it's mail order. And if I look under plan detail here, what I'm going to see is that, just looking at the difference between Walgreens is in network, and it turns out to be much cheaper than all the other things around me by a considerable amount. This is $3,000 savings over the year, and it gives you what you will be paying each year. So it's really important to figure out what your drugs that you may be taking, and do some simulation of what it is that you're going to do, and then certainly call and check afterwards to make sure that those drugs are covered by the plan. Again, really important to do, but that gives you a simulation of 2 of the drugs that we use with NET patients. So with that, I'm going to do a different screen share and see if I can do this again. 1 second. I think I can find this. There we go. And so some of the questions we've asked, just to make sure, how is Medicare different than group health insurance? I think we've talked through this. It's mostly like a PPO if you are using original Medicare. Would that be you can see the doctors you want, mostly in-state, out-of-state. It doesn't really matter as far as that, and that's one of the big highlights that you took us through between original Medicare and Medicare Advantage, that you're kind of honed into a specific group as opposed to potentially having the ability to select your doctors. We've talked about, does Medicare cover PRRT for the indications as referenced, and that is a great thing to talk to your provider about as well, because they'll certainly work to make sure that they get paid for it. They're not going to assume that you're going to be on the hook. I think it's anywhere from $75,000 to I've seen bills as high as $250,000 for that. So I don't think they're going to let you do that automatically. I realize I shared the wrong kind of tab. So let me quickly get to the right tab here. Although that looked fine, but let me see if I can find what I'm looking for here. Why can't I find that? That's okay. Let's go to window. I guess I am going to share just that one. The next one to look at here, does Medicare, what we've covered that one, sorry. Let me set that to archive. Due to diagnosis, we've covered some of them. There's certainly many other diagnoses, end-stage liver disease also, but there's a whole area on Social Security disability that you can take a look for that will help you.
Yeah, and I want to point out, yeah, I do, just because the disability piece, just remember, you're applying to Social Security for the disability piece, and there's going to be a whole evaluation as to whether they're considering you disabled. But keep in mind, even if you get that disability, it's determined, you're going to have a waiting period of 24 months before your Medicare is eligible. So keep that in mind too.
Yeah, no, that's hugely important, with the exception of ALS. I right. thought that was interesting.
ALS and ESRD, yeah.
Right. So we've talked about this in scans as well. Cost-effective plans. And the Medigap as well. Is it easy to look at Medigap? And is there differences between what companies will cover for if someone's on a Plan G?
No.
Are all the Plan Gs the same?
All the Plan Gs are the same, and all the Plan Gs are the same. All the Plan Ds are the plan. They're standardized across the country. They are standardized. I struggled as to where to tell you to go for good information, because often I send people to their local insurance, a Department of Insurance. I don't know if that's because that's normally you get a nice list, and I try to find a place it's very unbiased as to not trying to sell you anything. But I know that in Maryland that was a good source. I looked in California. It didn't look like I didn't find there was a great chart available, so I didn't quite know where to send folks. Medicare does indeed, on the Medicare.gov, there is a supplemental plan finder. I just don't find it that good. I just don't find it that good. So again, I would talk to your SHIP counselors because they have access to a tool that I think is better. And so I would say go to your SHIP counselor and ask them to send you a list or provide you with a link or something of a document that does indeed provide you with a list of all the Medicare supplement plans in your area.
So this one was something I'm not sure of the answer. Does it matter where you list your primary residence if you travel all the time for Medigap? Is
No,
that
if you have a Medigap plan, it doesn't matter. You can get the services no matter where you are, as long as you're using a Medicare provider.
right? And one of the things, it's not like they're separate. They can, if Medicare approves a treatment, the Medigap provider is required to pay for that. For that supplemental part of it, they can't deny it if Medicare has approved it.
There's no claims review for Medicare supplements. If Medicare pays, then the supplement pays.
Right. I think that's a great point to bring up.
Yeah, that is.
We've talked about this lanreotide and travel domestically. It's really important to try to find providers in each of the places you're going to need this in order to let them to arrange an appointment to do that. I know I've traveled to New York, and they were able to take care of me when I needed a shot during that period as well. So if their insurance, if the company's insurance ends in June, in the middle of the year, how do they do that to make sure, or how do they alert Medicare that they're going to lose private insurance?
Right. You have, when you lose your private insurance and because you were actively employed, you have an 8-month window to get new insurance. Okay. But it's important to keep in mind, you need to have coverage during that time. So normally you have to call Social Security to start the ball rolling. You need to either call Social Security or go on the socialsecurity.gov website and enroll in Medicare. And so that is what you would do. But remember, you want to get Medicare Part B, you can get it once you turn 65, you can enroll in Medicare Part A. Okay. And it doesn't cost you anything for the most part, but Medicare Part B is when you're going to have to start paying that premium. So if you're going to be losing your health insurance in June 30th, maybe you want to set it up so you're starting in July. So you'd want to call Medicare prior to July 1 and say, I would like to get my insurance. Typically it doesn't take long. It takes, maybe the next month you can enroll into Medicare, and it normally starts on the 1st of the following month. So you would want to make sure you start that process, that if you're going to lose coverage as of June 30th, you want to make sure you're July 1, you have Medicare. So you need to be going to Social Security website or calling Social Security. And normally you can go into the office, but that's not happening right now.
Yeah, no, that's clearly not happening right now. And the last question that I have up here for now, unless one or two more come in, Medicare due to disability, what are the Medigap options, and when do I need to do this?
Right, Medigap plan options. You normally, let's see, it's D. It was C. Now it's D. Medicare A and D is what's available for Medigaps for folks under 65. And I don't even know that not every state is required to sell those. They don't. Not every state is required to sell a under 65 policy. It's not a requirement. So if you know your 24-month, if you're going to be eligible for Medicare in 24 months, or within a time, you'll have a Medicare effective date, and you're going to want to get your Medigap. You want to get your Medigap within that first 6 months of eligibility of Medicare Part B. So that's what you want to do.
Yeah, otherwise there can be a challenge because while in that first 6 months there's no underwriting, after that 6 months there can be underwriting,
right?
And the clock doesn't get reset until you're 65. Just to 1 second, I'll share another screen here. For those of you who are interested, I think I can find that. These are the states that require Medigap insurance for people under 65 with disabilities. And so this is a great place to go well, actually, here's the actual article. It's from the Kaiser Foundation. But this gives you an idea of the states that are required to sell you Medigap if you're under 65. And those are the gray states are where you're not required to actually to do any underwriting for those under 65. So really important if you live in the blue states to get this done, and if you live in the gray states to work locally to try to get them to require Medigap insurance for those under 65, because it makes without Medigap it's challenging to do that. I will say one of the things in discussing the original Medicare versus Advantage is certainly if you go to Advantage and then decide a year later that you want to, and you're disabled and you want to go to original Medicare, underwriting applies, right? There's a potential that you might not be able to get back onto original Medicare.
Right. There's not a guarantee issue with that. That's exactly right. You have a year within just under a year. I always tell people, don't wait the year. If you're under a Medicare Advantage plan and you want to try it and see if you like it, make sure, and you want to get out before the year's up, because that way you can get out and then go pick a Medigap plan.
That's great. Any other words of advice for those of us who are facing Medicare this year? And any trends that you've seen other than the Joe Namath commercials?
Oh, I just be aware of guard your Medicare card. I mean, what we're seeing is so many scams. And what I also would say, remember, if you're going to do a telehealth visit, telehealth has copays that are exactly the same as they would be if you are seeing a doctor in person. So what you are finding is that sometimes your old doctors will call and they'll do a check-in on you, and they're not really checking it on you, and because they don't really check in, but then they charge you a copay of some sort. So I would say a telehealth visit is arranged in advance, and it should be a proper length, and you will be billed the same amount as if you went in person. So I would say just be careful about that, and keep that in mind. And again, be wary about any supplemental benefits if you are deaf or looking at Medicare Advantage plan. There are limits on all of those, and they're not spelled out on Plan Finder at all. So that's why you certainly need to call the plan and make sure you know the limitations. There may be a dental benefit. It may be a benefit of $250. There may be some type of vision benefit again, but it may be very limited. So I would say make sure, know what you're purchasing before you do, and call the plan.
Okay, and I'm just going to put up your contact information one more time, and thank you for spending the hour with us. And with that, I am going to somehow magically end the broadcast here in the right.